It was my third visit to the Tata Medical Center, Kolkata, where my late maternal grandmother was being treated for peritoneal carcinoma. I was waiting in the lobby with my mother and aunt when suddenly the surroundings around me seemed unreal and dreamlike. I couldn't recognize the place. I started asking questions like, what is this place? Why am I here? Who are these people around me? Where am I going and why? I felt that I am only an observer and that I have no control over my body whatsoever. I was doing everything on autopilot mode. My mind was kind of blank, and at the same time, I was questioning things around me. When I looked at my hands, they seemed weird, and I was doubtful whether they were really mine or not. I was literally going insane trying to make sense of it all. I was confused beyond comprehension, but it ended as suddenly as its onset. During this altered experience, the person is aware of reality and that their experience is unusual. The experience is very distressful, even though the person may appear to be unreactive or lacking emotion. Welcome to my channel, BipolarIITian, and today I will focus primarily on different aspects of dissociative disorder. Dissociative disorders involve problems with memory, identity, emotion, perception, behavior, and sense of self. Dissociative symptoms can potentially disrupt every area of mental functioning. Up to 75% of people experience at least one depersonalization derealization episode in their lives, with only 2% meeting the full criteria for chronic episodes. Women are more likely than men to be diagnosed with a dissociative disorder. Examples of dissociative symptoms include the experience of detachment or feeling as if one is outside one's body and loss of memory or amnesia. Dissociative disorders are frequently associated with previous experience of trauma. There are three types of dissociative disorders. Number 1, dissociative identity disorder. Number 2, dissociative amnesia. And number 3, depersonalization derealization disorder. Dissociation is a disconnection between a person's thoughts, memories, feelings, actions, or sense of who he or she is. This is a normal process that everyone has experienced. Examples of mild, common dissociation include daydreaming, highway hypnosis, or getting lost in a book or movie, all of which involve losing touch with awareness of one's immediate surroundings. During a traumatic experience such as an accident, disaster, or crime victimization, dissociation can help a people tolerate what might otherwise be too difficult to bear. In situations like this, a person may dissociate the memory of the place, circumstances, or feelings about the overwhelming event, mentally escaping from the fear, pain, and horror. This may make it difficult to later remember the details of their experience, as reported by many disaster and accident survivors. Dissociative identity disorder. Dissociative identity disorder is associated with overwhelming experiences, traumatic events, and abuse that occurred in childhood. Dissociative identity disorder was previously referred to as multiple personality disorder. Someone diagnosed with DID may feel uncertain about their identity and who they are. They may feel the presence of other identities, each with their own names, voices, personal histories, and mannerisms. Symptoms of dissociative identity disorder include the existence of two or more distinct identities or personality states. The distinct identities are accompanied by changes in behavior, memory, and thinking. The signs and symptoms may be observed by others or reported by the individual. Ongoing gaps in memory about everyday events, personal information, and past traumatic events. The symptoms cause significant distress or problems in social, occupational, or other areas of functioning. Dissociative amnesia. Dissociative amnesia involves not being able to recall information about oneself. This is unlike normal forgetting. This amnesia is usually related to a traumatic or stressful event and may be localized, that is, unable to remember an event or period of time. This is the most common type. Number 2, selective, that is, unable to remember a specific aspect of an event or some events within a period of time. And number 3, generalized, that is, complete loss of identity and life history. This is relatively rare. Someone with dissociative amnesia will have periods where they cannot remember information about themselves or events in their past life. They may also forget a learned skill or talent. These gaps in memory are much more severe than normal forgetfulness and are not the result of another medical condition. Some people with dissociative amnesia find themselves in a strange place without knowing how they got there. They may have traveled there on purpose or wandered in a confused state. These blank episodes may last minutes, hours, or days. In rare cases, they can last months or years. Depersonalization derealization disorder. Depersonalization disorder involves significant ongoing or recurring experience of one or both conditions. Depersonalization, that is, experiences of unreality or detachment from one's mind, self, or body. People may feel as if they are outside their bodies and watching events happening to them. Derealization, that is, experiences of unreality or detachment from one's surroundings. People may feel as if things and people in the world around them are not real. People and things around you may seem lifeless or foggy. You can have depersonalization or derealization or both together. It may last only a few moments or come and go over many years. During these altered experiences, the person is aware of reality and that their experience is unusual. The experience is very distressful. Even the person may appear to be unreactive or lacking emotion. Symptoms may begin in early childhood. The average age a person first experienced the disorder is 16. Less than 20% of people with depersonalization derealization disorder first experience symptoms after age 20. There are many causes of dissociative disorders, including previous traumatic experience. Someone with a dissociative disorder may have experienced physical, sexual, or emotional abuse during childhood. Some people dissociate after experiencing war, kidnapping, or even an invasive medical procedure. Switching off from reality is a normal defense mechanism that helps the person cope during a traumatic time. It is a form of denial, as if this is not happening to me. It becomes a problem when the environment is no longer traumatic, but the person still acts and lives as if it is, and has not dealt with or processed the event. Many people with dissociative disorder make a full recovery with treatment and support. Dissociative disorders are managed through various therapies, including psychotherapies such as cognitive behavioral therapy and dialectic behavioral therapy. Number 2, eye movement desensitization and reprocessing. And number 3, medications such as antidepressants can treat symptoms of related conditions. I wanted to also share my personal experiences, but the video has already become quite long, so I'll talk about it in my next video. Thank you, that's all for today, and I'll see you in my next video. Bye, take care, and subscribe to my channel for more such educational videos. Please suggest any topic related to mental health on which you would like me to make a video on. Thank you.